I trusted the system. I trusted the guidelines. I believed I understood health better than most people. And I was wrong. Despite access to the best specialists, the best labs, the best data, my own health was quietly getting worse. Gut issues, inflammation, brain fog. The turning point wasn't another medication. It wasn't another test. It was something the medical system barely talks about. And what I discovered forced me to question everything. I spent 20 years running hospitals. As CEO, I had access to the best specialists, the best labs, the best data money could buy. My job was literally to make people healthy, and yet my own health was quietly failing. Gut issues, inflammation, brain fog. The system I helped run couldn't fix me, so I walked away. I tried everything the system offered, and I still didn't feel good. So like many of you, I started looking outside of the system. So here's the honest version of the story. The thumbnail says I was wrong, and I was. But at the time, I thought I was doing it the right way. So wrong number one. I thought low carb was the destination. It wasn't. It was the on-ramp. Cutting carbs helped. It helped a lot. But I plateaued. I still had some gut issues. I was still managing symptoms instead of actually fixing anything. Low carb buys you time. It doesn't buy you health. Wrong number two. I thought pure carnivore was the final answer. And carnivore is powerful, and I totally believe in it. I'm not walking that back. Going completely carnivore in Argentina was truly transformative. But I started noticing things. Digestion fell off in certain ways. Energy would dip unexpectedly. Something was still missing. And I kept thinking, if this is the perfect human diet, why do I still feel incomplete? Wrong number three, and this is the big one. I thought the gut microbiome didn't matter on a meat-based diet. Everything I read, everything I heard said you don't need to worry about it. But the carnivore community is pretty unified on this. You don't need fiber, you don't need fermented foods, your gut adapts, and I believed that for a while. When I actually started adding fermented foods back in, the difference was undeniable. Digestion, energy, mental clarity, all of it shifted. And when I started reading the research on what happens to the microbiome during long-term carnivore, I couldn't unsee it. So that's the three things I got wrong. And those three things are exactly why this channel exists. And that pivot, the realization, is why you're seeing a change. So today, we're rebranding the Low Carb Leader to the Gut Friendly Carnivore. This isn't just a name change. It's a commitment to a more complete way of eating. It's about understanding that the gut microbiome isn't a footnote on a carnivore diet. It's central. It's the key to unlocking true metabolic health, in my opinion, lasting energy, and finally fixing the issues that even a hospital CEO can't escape. This channel will now be your guide to eating meat, embracing fermented foods, and truly healing your gut. And I'm not just talking about it, I'm living it. For the next 3 months, I'm in South Korea. This is the land of fermented food, the culinary tradition built around fermented foods. You'll see me cooking or attempting to cook authentic Korean dishes, exploring daily life, trying everything from street food to high-end restaurants, all while sticking to a gut-friendly carnivore approach. And I'll be getting full blood work done in Korea. We'll compare the cost, the quality, against what we pay for in the United States. Is the system truly better elsewhere? We're going to find out. This is where the real experiment begins. And you're coming with me, I hope. Thank you for being here. And if you've been with the Low Carb Leader for the last several years, thank you. And I'm so happy to be back. And if you're new, I thank you for joining our journey. And if all this sounds good to you, hit that subscribe button. I'll see you in the next video.